Hi, I'm Adam Canning, Clinical Laser Therapist at the Trobe Health Centre in Geelong. I'm going to be talking with AFL footballer Nick Maxwell today about laser phototherapy for accelerated recovery from injuries. Welcome, Nick.
Thanks for having me, mate.
Nick, you've been utilising low-level laser therapy for a number of years now for a variety of injuries. Can you tell me a little bit about those treatments that you've had?
Yeah, well, I guess from the start, I turned to laser therapy out of desperation. I broke my thumb in 4 places. I had a plate and 8 screws put into that, and I was told it was a 12-week injury. It's 3 weeks before finals, so I wanted to be back playing finals. So I heard laser therapy could help me with my recovery. So came down and started seeing you after the first week, and saw you every day for probably a month there, and I managed to be back playing after 3 weeks. So it got me back for finals, which was great. And I became a believer from then, and it wasn't just about treating the fracture itself, but about treating, I guess, all the cells around that area and making sure that they got the attention they needed. And
exactly.
The next year I broke my wrist, had a screw, 2 screws put into a bone there, and I was told that was an 8-week injury. I returned after 4 weeks with the help of laser therapy, and from then basically every time I've had any sort of soreness or injury, I've been treated. And it's not just about, I guess, treating the injuries, but also injury prevention. I've spent a fair bit of time using the laser therapy machine before training sessions, so when I've felt really tight in different areas, use the laser therapy, which has freed them up. And from there I've been able to actually go out and train when without that help I probably wouldn't have been able to train. So it just helps me with fitness and all those type of things. So it's definitely been something that I've recommended to people over the last few years, and something that's been important in my football career.
And we know that you've just recently, 6 days ago, had a arthroscope done on the knee, and they've done quite a bit of work in there. Can you tell us a little bit about what's happened?
Yeah, basically after a long career you get a lot of damage in different areas, and my right knee copped a lot of that. So I've had an arthroscope which cleaned everything up, but also had to shave a lot of bone back. I had a lot of bone spurs going on in there, so it was pretty swollen and pretty damaged, but I think that we'll get some good treatment out of it today and hopefully get rid of a lot of that swelling. So I broke my thumb in 4 places across here, as you can see the scar that's there. So I had a plate put in there, 8 screws running along it, and I was told that was 12 weeks, and with laser therapy I came back after 3 weeks, which was pretty incredible. And the next year broke my wrist, you see the scar across there, and had to have 2 screws put into my wrist there. And yeah, from there that was an 8-week injury and returned after 4 weeks. So I've had all the knee cleaned up, and you can see there's 3 different entry points, and you can tell just comparing it with 2 knees that it's a huge difference in how damaged they are. So you need some laser therapy through this one and hopefully get it right.
We'll be using some of the latest laser technology. It'll have a variety of different approaches, and we'll do pre-treatment and post-treatment effects and see if we can't get you feeling a lot better.
Sounds good to me.
Excellent. All right. I'd like to introduce Tina Check. She's from the Australian Institute of Laser Therapy. She specialises in laser tissue repair. We're going to have her have a quick look at Nick's knee and see if she can give us some advice on how we can best manage him today. Thanks, Tina.
Thanks, Adam. Hi, Nick.
How are you, Tina?
All right. How are you feeling? How's the pain?
It's pretty sore actually, and pretty swollen. So. Yeah.
And when was your op?
6 days ago.
Okay. Are you on much pain medication at the moment?
Not anymore.
Okay. And you've got issues with your edema right through your leg. So, any specific areas within the knee area that are bothering you in particular?
All of it.
How were you after the last couple of treatments we did with the big combination?
Yeah, they had big improvements.
Terrific, yeah. Good. So we're going to treat this whole knee on a trauma setting, and we will treat the entire knee, and also using a 904 on the cardinal points of the knee and the popliteal behind the knee on the setting for bone joint. Okay, now we can see on this injury site that occurred some 4 weeks ago, we've had considerable healing to the soft tissue side of things, but we can still see significant distortion within the ankle region, so we need to continue treating to help with alignment, and we will use also our 904 cluster for that. on the bone setting. Okay, so we can see here on this lateral side of the ankle that we've still got quite a lot of swelling and deformity, and this has continued over the last few sessions we've done, and that will continue to remodel as we treat. So it is very important in this critical stage to continue treating till we get the alignment back in the ankle bones as well, in the actual joint.
So first of all with Nick, what we're going to do is treat the spinal cord. The reason we're going to do that is to reduce any spinal tension and associated subluxations as a result of previous injuries and current injuries that may be present. I'm going to select the spinal cord program in this instance. This is using the Photonic 500 by RJ. It's a scanning laser. All of these programs that you can see in here actually have particular biofrequencies which match the condition we're treating. So it will automatically select the frequency combinations that we need. I can also select acute or chronic. In this case, I'm actually going to leave the system on its normal mode, which will cover everything that we need. So I'll go back into the orthopedic menu and we'll be ready to interface with it now. Okay, so now we've activated the Photonic 500 on the spinal cord program. We will be treating from C1 right down to the sacroiliac. At the moment you can see that it's just trailing over C1 to T2. So once it finishes its protocol, it'll take around 2 minutes. We'll move to the next stage. So after we've just administered the treatment on the spinal cord on Nick, we're now going to use the RJ Physio Laser Olympic with the sublingual attachment. This particular attachment is very good for cardiovascular health and for supporting the central nervous system. In this case we're going to use it for overall weakness that may be present within the organism post-surgery where there's been some trauma. So I'm going to activate that now and we're going to position it underneath Nick's tongue. Goes down. So now what I've done is attached a 904 nanometer 5-diode cluster to the Photonic 500. We're able to interface that with the same menu. We're going to treat either side of the sacroiliac to improve pelvic alignment and minimise weight loading on the hip, knee and ankle joints. Okay, so we're using the RJ Physio Laser Olympic. I've got it set on trauma acute after Nick's had the arthroscope 6 days ago. As we can see, there is still quite a lot of swelling, so I'm going to irradiate around the entire patella and to increase movement and cell activity.
I have with me today the Chinese medicine practitioner and acupuncturist Dr. Kerry Posniak from the La Trobe Health Centre in Geelong, who will be discussing her acupuncture point of treatment to support Nick's recovery.
Thanks, Tina. Okay, so today, obviously we wouldn't do all of this treatment in one day. Nick would come on a separate day and have a separate treatment from an acupuncturist perspective. So today we're using the light needle, which is very useful because it allows us to input energy and information into the meridian system, which is unique. So these are frequencies by Dr. Reiniger. So for example, today we have liver 2, which is fantastic for getting rid of the heat out of Nick's knee. We've got liver 3, very common points that a lot of acupuncturists would use. Gallbladder 34, stomach 36, bladder 40, spleen 7, large intestine 4, pericardium 7 for circulation. So a fantastic system in that, as I said before, you can, if we look closer at the machine, for example, we can choose liver meridian, and then the machine will actually put the specific frequency for the liver channel, which will then go into liver 2 and liver 3. And the same thing for gallbladder.
And the beauty of the light needle is being able to treat 12 points simultaneously in the one 10-minute session, which is really impossible with needle alone. So it does add another dimension to acupuncture that I'm sure you've seen the benefits for in other patients.
Fantastic.
So we've just finished a laser phototherapy treatment on Nick, and I can certainly notice a big difference, but what about you, Nick? How does it feel?
Yeah, it feels a lot better. So pain-wise, it feels a lot better, number one. Number two, I can sort of see that the swelling's gone down a fair bit. Obviously I've got a lot of work to do, but it's only just the one session and that'll continue to go out. I can also just notice that I can see the metatarsus in my feet and my toes. I couldn't actually see any of that beforehand because my foot was so swollen from all the blood flowing down there. So yeah, it was really good, and have to keep the treatments up to make sure I can get the most benefit.
Yeah, so I can certainly see as well that there has been some good lymphatic drainage there, removal of those metabolic wastes which are kind of prolonging that inflammatory process, and also the pain associated with it. So we'll see Nick again tomorrow.